Hi, my name is Ian Battersby. I'm one of the clinicians at Davies, and we've been putting together a series of little videos doing walkthroughs through parts of the practice that the clinicians work in and we can't give you access to on a daily basis. As you know, the practice is split up into a variety of different areas. So there's the diagnostics, there's the kennelling, and then today we're going to talk about the theatre area. So if your pet is admitted after a consultation for an operation, these are the parts of the practice that they'll be working their way through. So the first part that we're going to talk about is the theatre induction. So when we talk about induction, it's induction of anaesthesia in preparation for the surgery. So each patient has an individual anaesthesia plan created by our anaesthetists, and together with our veterinary nurses, preparations are made for each individual patient. As you can see, there's 2 stations in this room. There's no patients here at the moment, but all the preparations are being made prior to them arriving so that everything can move as quickly as possible. Now, once they're asleep, they're clipped and prepped for surgery and all the monitoring equipment is attached, and then the patients then move into theatre, and we're just going to move around now to show you where they go. So the patients move up the corridor on a trolley, anaesthetised and with all the monitoring in place, and just through this door here at the end is where they're going to move into theatre. However, probably what I should point out as well while we're here is this room, and we'll just go in here. So this is our X-ray suite. As most modern veterinary practices now, we have digital X-ray, and all patients that are undergoing X-rays generally are anaesthetised or heavily sedated. So there's again an array of monitoring equipment to make sure that they're safe and there's no complications while they're anaesthetised. Now, the reason why we've located this room so close to the theatre is that a lot of the operations, particularly orthopaedic operations, need post-operative X-rays. So it's very quick and easy for the patient to come out of theatre, move into the X-ray suite, have X-rays, make sure the plates are all in the right place before we wake them up. As I was saying before, the patient will move through here on a trolley, and then they're going to go through this door into our theatre prep. And before I go into there, I need to get changed into theatre scrubs, so I'll be with you in about 10 seconds. So after a quick change, we're now in theatre prep. So this, our patients have moved through on the trolley anaesthetised into the theatres. We've got 4 theatres on this side of the practice. But this area is also quite important, the prep area, because there's a lot of activity that goes on in here, whilst the animals are in surgery, but also prior to them entering the theatre area. So first of all, we've got our scrub sinks, so allowing the surgeons to surgically prep their hands before gloving up, and then as well as gloving up, they'll move into sterile grounds. Just above it is quite an important bit of theatre prep. This is the operations list and scheduling that allows our theatre supervisors to coordinate how patients move through the practice, and also in using all the different theatres at different times. Of course, any theatre needs a crash trolley, which is here. So this is for those hopefully rare situations where complications happen and a patient might arrest. So this equipment's on close hand. We've got a defibrillator here. So we've passed 2 theatres already. We're passing some large number of cupboards with all the different types of surgical equipment used for orthopaedics and soft tissue surgery and neurological surgeries. And there's another surgery theatre suite here that's got an operation going on at the moment. Theatre 1 hasn't got a patient in there at the moment, so we're just going to take that opportunity to go inside and show you the layout of these rooms. These theatres are very similar to probably some of the images that you see on some of the dramas, such as Casualty. A lot of the equipment that we use is used in human hospitals. So of course, each theatre needs a theatre table that can move up and down to allow the surgeon to operate at a comfortable height. We've got the theatre lights to ensure that the lighting of the operating, the area that they're operating on is optimal. We've got all the anaesthesia equipment. Most of our theatres have ventilators to allow complex surgeries done on the chest, and then a massive array of ECG monitoring equipment that is vital in the kind of surgeries that we do here. In addition, we have TV monitors to allow surgeons to put up images that have been taken from MRI scans and CT scans so that they can refer to them during the operation, just to ensure that they've got everything, all the information they need to know and at hand. So we'll now just move to the final part of theatre prep. So like most theatre preps, they have an area for dirty equipment. So after the operation has occurred, the equipment needs to be cleaned, has its initial scrub here before moving into our sterile supplies area that we're just going to go and have a little look at now. So that's actually a pull door rather than a push door. So as we move into here, you can see that it's quite a clean area. The equipment moves through into the sterile supplies area, and it's initially inspected to make sure that the first clean has gone well, and then the equipment is packed into 2 sets of envelopes prior to packing for sterilisation. And an example of those envelopes is here. So this is I'm an internal medicine clinician, so this is not quite my area, but I understand those are rongeurs that are used in spinal surgery. And on the back of the envelope, there's a series of indicators that turn brown once we know that the sterilisation process has gone correctly and this equipment is safe to use in an operation. So this equipment is then packed either in a cage or in one of these big boxes here. This has a whole array of different kit before being placed in either one of these 2 very large autoclaves, and they undergo a sterilisation process, and then once that's complete, we can then use it in the cases that are in the theatre. So this is the main theatre prep and the main theatre area, but we have one theatre that is set out on its own next to the diagnostics area, and that's the Ophthalmology Theater that we're just going to go and have a quick look at now. So we've now moved over from the main theatre area to the Ophthalmology Theater, which is Theatre 5, which stands alone and is next to the diagnostics area. And I'm just going to do a brief talk through this area. So just round the corner we have our Anesthesia equipment and induction area that is specific for the Ophthalmology Theatre. So this is the surgeon's scrub sink, so they can prepare prior to operating, and then glove and gown. And then it's a very short journey in this setup into the ophthalmology operating suite. So one piece of equipment that's unique to this theatre is the operating microscope. This is a vitally important bit of equipment for some of the very intricate surgeries that the ophthalmologists perform involving the inside of the eye. So this is primarily things like cataract surgery. There are other specialist bits of equipment that we use in the other theatres that are moved between the theatres. An example of which would be the Fluoroscopy Unit. That's a bit of equipment that allows us to take intraoperative x-rays and moving x-rays during surgeries such as fracture repairs, spinal surgeries, but also some of the interventional radiology procedures where we put stents in kidneys, but also balloon dilations in hearts and things like that.